is Marie. Thank you so much for watching my presentation on motivational interviewing. We've all heard a lot about motivational interviewing lately. So why do we need extra information on this? The goal of this presentation is to very briefly highlight the motivational interviewing principles and skills for us nurses. We would not be focusing on all of them. We would primarily focus on the open-ended questions to guide our obese veterans, consider weight management intervention, and promote the MOVE program. I know we are all very busy, so I like to reassure you that using motivational interviewing does not mean you will be spending more time with the patient, but rather making your time with the patient more productive. So the real question is, why isn't the threat of obesity causing poor health and potentially premature death enough to convince the patient to begin exercising, change their diet, or join the free MOVE program? And the simple answer is ambivalence. Most of us have tried to lose weight in the past and failed. So we know it's not easy. We want to lose weight, but we also know it isn't easy to exercise and stick to a diet. And this is where motivational interviewing comes into play. This is a communication tool that helps patients verbalize their own motivation for a change. So the patient comes up with a solution to the problem versus nurses or providers trying to tell them what to do. The 4 principles of motivational interviewing include express empathy, develop a discrepancy, roll with resistance, and support self-efficacy. The 4 skills of motivational interviewing include reflective listening, asking open-ended questions, affirming, and summarizing. For us nurses, and for the purpose of this presentation, we will only focus on how to use open-ended questions. And I provided some examples here on the slide, such as, on a scale of 0 to 10, how concerned are you about your elevated BMI, or how ready are you to start losing weight and improving your health? What resources are you using to help you achieve your weight loss? And, of course, we want to ask permission to make sure the patient is on board before offering any intervention. The following few slides show some common traps and how to avoid them. The most common ones are patients ignoring the problem, arguing, or denying that there is a problem. So, for instance, you talk to the patient about the importance of losing weight. And the patient says, well, to tell you the truth, I don't see why I should lose weight. I like my food and don't see the point of denying myself. The best way to avoid this trap is to use open-ended questions and have the patient provide the reason why they should try to lose weight. So you can ask, how important is it for you to lose weight and be healthy? The next one is called question-answer trap, where we ask one question after another. The best way to avoid this is to use reflection and limit the number of questions we ask the patient. For example, I see you are concerned about being overweight and having poor health. What resources are you using to help you succeed? Expert's trap is one of the most common one. We've studied the topic, we've seen it, and we know what's best for the patient. So we want to tell them what to do and be done with it. One way to avoid this trap is to allow the patient to come up with his or her own solution or tell you what will work for them. And lastly, the premature focus trap can negatively impact provider-to-patient relationship. This is the case where we offer what we think is the most obvious solution to a problem without considering patient's needs. Let's say you see this patient who's 380 pounds. He can barely walk from the parking lot to the office and was having a hard time catching his breath. You know his weight is the problem, so you said, why don't you join the MOVE weight loss program? It will help you lose weight and you'll feel a lot better. And the patient replied, I don't care about losing weight. I'm here for my worsening PTSD and depression. One way to avoid this trap is to simply ask the patient an open-ended question, such as what is your main concern today? Or how can I help you today? Thank you very much for watching my presentation till the end. We will send out a post-survey and collect the data to see how motivational interviewing helped us improve our numbers of referrals to the MOVE program. So please take 2 minutes to complete the post survey, which will be sent out in a couple of weeks. And I've included my email. So after the post survey, if you would like a chance of winning one of the 10 gift cards, please email me your name. This will not change anything. Your response will remain anonymous regardless of whether you send me your name or not. Thanks again for attention.